Good afternoon. Today we're done with the surgery. Normally I do my videos before the surgery and explain the surgery. Today this was a very difficult case, so I wanted to do this video after the procedure where I could have explained, or I wanted to explain the procedure what I did. So today's case was a difficult case where we were placing the implant in both molar region. This is the left lower molar, and on the right side we had placed two implants on both the molar area. This was a healed bone area. Normally I talk about more of an extracted area, but because this is a healed bone area, this should have been a straightforward case. So why I'm saying that this was a difficult case? So this was a difficult case because this was an old extraction. There was a bridge here. I removed the bridge. There was an infection, so I treated this tooth with a root canal. We are planning to do a root canal with this tooth also. And on right side also, there was an extraction which were done long back. So the challenges we had in this area was because there was a big gap between this premolar and a molar. I wanted to put a broader implant so that when you place a crown, the crown should be coming and having a broader base. But in a cross section, when we saw this X-ray, the bone available was not sufficient for the broader implant. So I could place only 4.5 mm into 12 mm. The width is 4.5 mm. I wanted a broader implant for the molar area, which is a 5 mm implant. So how I place the 5 mm implant now? So the procedure is called ridge split, where we split this ridge. The ridge is ridge is this bone which is remaining after the extraction, which should have been here, but because it was old extraction, the ridge collapses. This is the reason which that is why I always tell to extract and put the implant. In most of my videos also, that is what I am explaining, why we should extract and place the implant, because I get this maximum width which is available to me. If we extract and leave the bone, this is what happens. The bone collapses. So now I'll show you in the cross section. Look at this. Look at this area. This is collapsed completely. This should have been here, but now because of the old extraction, this is collapsed. So I'm gonna split this ridge. I'm gonna give a cut into the split ridge and open the bone like a trapdoor. Like a trapdoor, we're going to open the bone. So this is called ridge splitting. So we did that ridge split procedure where I had split this ridge, opened this outer bone, pushed the outer bone outside, place a wider implant and filled that area with the bone graft. I had the same issue on other side also. If you can appreciate here, I have the ridge which is very thin in the frontal area. So this front implant, that is a first molar area implant, is not completely covered with the bone graft. But because there are two implants now, I don't want a broader implant. Two implants can take care of the prosthesis because we're going to fuse them. So here we have not done a ridge split. We have opened the area and placed the implant. So this exposed threads which we have just seen, this was exactly the same way in patient's mouth when we placed the implant. This area we have grafted with the bone. So this area was grafted with the bone, and the other side we did the ridge split. So this is another difficult procedures which we do, and you require a maxillofacial surgeons or an expert implantologist for doing this kind of procedures. Though this looks like a straightforward implant, a novice dentist or an implantologist would have done is they would have placed a smaller, thinner implant into the area according to the ridge or according to the bone availability. The complication of thinner implant into the area, it would have healed, it would have osseointegrated, it would have fused with the bone, but in long term, when a smaller diameter implant has a bigger, broader crown. So what will happen is my crown will be having lot of cantilevers on both the sides. So when the patient gonna eat, this crown is gonna put forces on either side of the implant, and these forces are like shaking the pole to take it out. So these are called cantilever and lateral forces. Now in this case, this is not a lateral, this is mesial and distal front and back forces also. So normal single implant do have cheek side and tongue side forces. Here the front and back forces also would have added. That is why a broader implant, lesser cantilever, lesser forces. That is why we wanted to put a broader implant. We could put a broader implant. We have placed 3 passive implant grafting, and we've just finished the case. We've just given a prescription to the patient, see of the patient, and making this video for you. Thank you.